Howdy, Michael Davies here with the pharmaceutical company. We will talk a little bit about the use and dosage of the drug and some of the side effects this medication. Levothyroxine, a thyroid hormone, should not be used alone or along with other treatments to treat obesity or cause weight loss. Levothyroxine may cause serious or life-threatening problems when given in large doses, especially when taken with amphetamines such as amphetamine, dextroamphetamine, and methamphetamine. Tell your doctor if you have any of the following symptoms while you are taking levothyroxine: chest pain, rapid or irregular heartbeat or pulse, uncontrollable shaking of a part of the body, nervousness, anxiety, irritability, difficulty falling asleep or staying asleep. Levothyroxine is used to treat hypothyroidism, condition where the thyroid gland does not produce enough thyroid hormone. It is also used with surgery and radioactive iodine therapy to treat thyroid cancer. Levothyroxine is in a class of medications called hormones. It works by replacing thyroid hormone that is normally produced by the body. Without thyroid hormone, your body cannot function properly, which may result in poor growth, slow speech, lack of energy, excessive tiredness, constipation, weight gain, hair loss, dry, thick skin, increased sensitivity to cold, joint and muscle pain, heavy or irregular menstrual periods, and depression. When taken correctly, levothyroxine reverses these symptoms. Levothyroxine comes as a tablet and a capsule to take by mouth. It usually is taken once a day on an empty stomach, 30 minutes to 1 hour before breakfast. Follow the directions on your prescription label carefully, and ask your doctor or pharmacist to explain any part you do not understand. Take levothyroxine exactly as directed. Do not take more or less of it or take it more often than prescribed by your doctor. Swallow capsules whole. Do not chew or crush them. Do not remove the capsule from the package until you are ready to take it. Take the tablets with a full glass of water as they may get stuck in your throat or cause choking or gagging. If you are giving levothyroxine to an infant, child, or adult who cannot swallow the tablet, crush and mix it in 1 to 2 teaspoons, 5 to 10 milliliters, of water. Only mix the crushed tablets with water. Do not mix it with food or soybean infant formula. Give this mixture by spoon or dropper right away. Do not store it for later use. Your doctor will probably start you on a low dose of levothyroxine and gradually increase your dose. Levothyroxine controls hypothyroidism but does not cure it. It may take several weeks before you notice a change in your symptoms. Continue to take levothyroxine even if you feel well. Do not stop taking levothyroxine without talking to your doctor. Levothyroxine may cause side effects. Tell your doctor if any of these symptoms are severe or do not go away: weight gain or loss, headache, vomiting, diarrhea, changes in appetite, fever, changes in menstrual cycle, sensitivity to heat, hair loss, joint pain, leg cramps. Levothyroxine is used to treat an underactive thyroid, hypothyroidism. It replaces or provides more thyroid hormone, which is normally produced by the thyroid gland. Low thyroid hormone levels can occur naturally or when the thyroid gland is injured by radiation medications or removed by surgery. Having enough thyroid hormone is important for maintaining normal mental and physical activity. In children, having enough thyroid hormone is important for normal mental and physical development. This medication is also used to treat other types of thyroid disorders, such as certain types of goiters, thyroid cancer. This medication should not be used to treat infertility unless it is caused by low thyroid hormone levels. Take this medication by mouth as directed by your doctor, usually once daily on an empty stomach, 30 minutes to 1 hour before breakfast. Take this medication with a full glass of water unless your doctor directs you otherwise. If you are taking the capsule form of this medication, swallow it whole. Do not split, crush, or chew. People who cannot swallow the capsule whole, such as infants or small children, should use the tablet form of the medication. For infants or children who cannot swallow whole tablets, crush the tablet and mix in 1 to 2 teaspoons, 5 to 10 milliliters, of water, and give using a spoon or dropper right away. Do not prepare a supply in advance or mix the tablet in soy infant formula. Consult your pharmacist for more information. Age, weight, medical condition, laboratory test results, and response to treatment. Use this medication regularly in order to get the most benefit from it. To help you remember, take it at the same time each day. Do not stop taking this medication without first consulting with your doctor. Thyroid replacement treatment is usually taken for life. There are different brands of levothyroxine available. Do not change brands without first consulting your doctor or pharmacist. Certain medications, such as cholestyramine, colestipol, colsevelam, antacids, sucralfate, simethicone, iron, sodium polystyrene sulfonate, calcium supplements, orlistat, lanthanum, sevelamer, among others, can decrease the amount of thyroid hormone that is absorbed by your body. If you are taking any of these drugs, separate them from this medication by at least 4 hours. Symptoms of low thyroid hormone levels include tiredness, muscle aches, constipation, dry skin, weight gain, slow heartbeat, or sensitivity to cold. Laboratory and/or medical tests, such as thyroid function tests, should be performed periodically to monitor your progress or check for side effects. Consult your doctor for more details. If you miss a dose, take it as soon as you remember. If it is near the time of the next dose, skip the missed dose. Take your next dose at the regular time. Do not double the dose to catch up unless your doctor tells you to do so. Call your doctor if you miss 2 or more doses in a row. Ask your doctor ahead of time what to do about a missed dose and follow your doctor's specific directions. Store at room temperature away from light and moisture. Do not store in the bathroom. Keep all medications away from children and pets. Do not flush medications down the toilet or pour them into a drain unless instructed to do so. Properly discard this product when it is expired or no longer needed. Before taking levothyroxine, tell your doctor or pharmacist if you are allergic to it, or if you have any other allergies. This product may contain inactive ingredients, which can cause allergic reactions or other problems. Talk to your pharmacist for more details. Before using this medication, tell your doctor or pharmacist your medical history, especially of increased thyroid hormones, thyrotoxicosis, decreased adrenal gland function, heart disease, such as coronary artery disease, irregular heartbeat, high blood pressure, diabetes. That's all for today. Subscribe to the Pharmacological channel and stay with us. Good luck.